Hello. We are having another segment of the AOC Action Crew. In our introduction, we have two speakers here with us tonight. For better or for worse, the world around us is in transition. Many have opinions on how and who is to blame. However, we are not here to discuss that tonight. Our goal is with research and interviews to determine where do we go from here. I have two guests with me tonight. They will introduce themselves. I have Brian Burton to my right, and I have Africa Dauphiny to my left. Mr. Burton, would you introduce yourself and tell us a little bit about you?
Sure, thank you. My name is Brian Burton. I am the CEO of Southwest Louisiana Area Health Education Center. We are a public health foundation with offices here in Lake Charles and Lafayette.
And Ms. Dauphiny, will you tell us a little bit about yourself?
Yes, my name's Africa Dauphiny, and I'm a nurse practitioner, also an informatics clinical specialist, and that's another show to figure out what that is. I've been in practice for about 14 years, beginning as an LPN, then moving my way up the healthcare ladder, and now a nurse practitioner.
Thank you, guests. My name is Jermaine Bro. I'm an informatics analyst. I've worked for the government many years and currently working in private industry. And our show tonight is on how does health insurance work? We have a lot of questions about health insurance, especially in today's environment. So I'm going to ask you first, Brian, what is health insurance and how does health insurance work?
Well, I mean, the most important thing to note is that health insurance is a safety net should something happen to you. Healthcare costs are extremely expensive, and they're not something that we can afford. So insurance is basically placing odds that should something happen to you, that you will be able to afford your healthcare coverage by buying a plan that will help you to do that.
Okay, and we have many plans available, and we'll discuss those plans. Ms. Africa, with the Affordable Care Act, where does that fit into health insurance?
Health insurance, the Affordable Care Act, it was enacted in 2010 by President Obama. During that time, it was an initiation to change the viewpoint of health care and to provide health care to varying views of individuals, regardless of their income or their ability to pay for insurance.
Okay, so our big topic, health insurance, it involves a lot of different kinds of abbreviations, all kinds of information. It involves a lot of money, a lot of different payers, those kinds of things. So when we say ACA and we refer to health insurance, Brian, how does that affect the regular American person?
Well,
How
I think
does
it's
that affect
important
them?
to note that most people in America get their health insurance through their employer. That's the number one way to do it. The Affordable Health Care Act was created a safety net for those that did not have access to employer-based insurance. So that includes folks that are self-employed, those that may work for a small business or industry, that just do not have access to employer-based insurance. And so what it does is it covers folks from 0% of the federal poverty level, meaning that they do not work, they do not make anything, up to the highest amounts that you can get. Those between 0 and 400 receive different types of subsidies. Those below 137 are access to Medicaid expansion. Between 138 and 400%, you get a subsidy to help pay for that. But that insurance is done in a separate place called the federal marketplace. That is where those folks can get that insurance. And right now we see across the country about 9 million people, right at about 100,000 people in Louisiana that have their insurance through this platform.
So the marketplace is very, very important. It's what we call Affordable Care Act. It's
Correct.
part of what we call Affordable Care Act Africa. Can you expound on that some more on what Brian said? I heard you saying that was correct, what he said.
Correct. And each state has their own marketplace as a baseline, and there's private insurers. Blue Cross Blue Shield for Louisiana is one of those that's in that marketplace. And it's a place to compare all of the healthcare insurers in one place, apples to apples, basically. And it keeps it very simple for the individual that goes to the marketplace to look for insurance. And also there's subsidies, if individuals can't afford to pay for that insurance, that they can get through the marketplace. And also, it will identify and let you know once you put your information in whether you qualify for things like Medicaid.
Okay. And when there's a mandate attached to this ACA and the marketplace, what is a mandate, Ms. Africa?
A mandate is something that's required.
Okay.
There's usually no leadway to the mandate. You have specifications of what's required in order to meet it, and if you don't meet those specifications, usually there are consequences that go along with that mandate.
Okay, and what kind of consequences would we be talking about? If I didn't want to choose to go into the federal marketplace, what would happen to me if I
You would
didn't
be
have
fined.
insurance?
You know, part of the Affordable Health Care Act law is that individual mandate that well, there's two different mandates. There's the employer mandate, which says that employers over 50 people must provide insurance to their employer. But then there's also the individual mandate that says that if you qualify, meaning that you make a certain point that you have to have health insurance. It's just like auto insurance. And if you drive a car, you have to have auto insurance on your car. Well, if you drive a human vessel, you have to have health insurance on that. And so that's what the individual mandate was.
Okay. So I'm hearing there's different kinds of insurance. I've heard you say Medicaid, I've heard you say Medicaid, Medicare, ACA, employer-sponsored plan. What is Medicaid?
Well, I think that what Medicaid is Medicaid was started as insurance for the poor, okay? It is basically state-run insurance that is provided to people who do not make enough money to be able to afford private insurance. And so in Louisiana, part of the Affordable Health Care Act expanded Medicaid, which basically meant it expanded the qualifications for participation. And as of December 18th in Louisiana, we have 456,000 people who have enrolled in an expanded Medicaid program. Now, for Louisiana, what Medicaid means is that these are managed care organizations, so it is private insurance. When you enroll into Medicaid in Louisiana, there are 5 different Medicaid companies that you have to choose from. You're able to pick which one best suits you based on different networks and things like that. But these are private insurance. It's not the old Medicaid that used to be around that was started under the days of Huey P. Long, where it was government-run health insurance. These are the government is just that intermediary that connects you to this private insurance company.
Okay. And so when you say Medicaid expansion, can you tell us a little bit about what Medicaid expansion did and what does it do to our insurance?
I guess at the baseline, we have to understand Medicaid. Every state has Medicaid, and there are certain rules that govern that Medicaid program for that state, and usually the states get to decide on how that looks, how that viewpoint is. Medicaid expansion, again, came with the Affordable Care Act, and some of those flexibilities that the state had were lessened for the Medicaid expansion. Certain income limits, disabilities, household size, family status, all play into whether you're can qualify for Medicaid or not.
Okay, all right. So we've heard Medicaid. We've heard a little bit about Medicaid, and it's expanded because of with the ACA Act and being able to get your insurance. Now, is there any reason why anybody should not be covered with insurance, since we have the mandate on the ACA, we have Medicare, we have Medicaid, we have private payers? Would there be a reason for somebody not to have insurance?
No, and I think that this is why you're going to see, once the dust settles from open enrollment in 2017 for 18, I think that we're going to see in Louisiana that we've probably hit just a little below the 10% uninsured mark, which will be the lowest we have ever seen in Louisiana.
Yes.
And that is because under the Affordable Health Care Act, it gave you insurance for everybody. So for those that make between 0% of the federal poverty level to 138, you've got expansion. For those that are above 138, you have subsidies to help you buy on the federal marketplace. And then once you're 4 times the federal poverty level, you should be able to afford it yourself, but you still have access to be able to purchase that. So now there is something for everybody. You talked about Medicaid expansion. And what it really did is that the criteria for entering Medicaid, for enrolling in a Medicaid program in Louisiana is one, you have to be, you have to be a Louisiana resident.
Yes.
And you have to make, less than 138% of the federal poverty level, and that's it. It doesn't matter what your health care costs are, or what your health care outcomes are. You qualify just, and so that expansion basically expanded exactly what you said, those different state criteria.
And one thing that sometimes people seem to forget about when it comes to Medicaid in general and also the expansion, you have to meet the citizenship requirement. So that brings another viewpoint and outlook to health insurance, because again, then there's still individuals who are what we call uninsured.
That's right. And so if you're here, if you're a legal alien, or if you're here, on a work visa or different things like that, there's possibility that you may not qualify for those.
Okay. Okay, so on a health perspective, the numbers that Brian gave, because you work in the healthcare industry, you're a nurse by profession, what does it mean for people to have more people covered under health insurance?
And I'll, I guess, give the perspective of we as a nation looked at viewpoints and perspectives and the expansion and what it would bring. Already in a state who had high percentiles for Medicaid population, so that population grew, like Brian mentioned before, by great numbers, leaps and bounds. And there were providers, from the provider perspective, of a certain quota, a certain number of patients that they would be allowed to accept or absorb into their practice based on your payer type, i.e. Medicaid. And this expansion created an even greater gap for that provider pool. And my thought process throughout this has always been, who's going to take care of these individuals? Now they have access, or they have the ability to pay for access, let me say that. And the question has always been, who's going to take care of these individuals? Who's going to absorb them into our system?
One thing, Jermaine, and that is, do you know that the number one reason for bankruptcy in our country is because of medical debt? And so when you ask what the importance of having health insurance is, it is to keep you from having to file, you and your family to have to file bankruptcy because some accident happened that ended up, costing more than you would be able to afford. So insurance acts as that safety net to protect you from that.
Correct.
All right. Now we also deal with, in all kinds of insurance, we deal with co-pays, we deal with deductibles, we deal with things like that. What is a copay?
Sure. Well, a copay is your portion of the medical expense that you're going to have to pay. So when you go to the doctor, your cost is the doctor is going to charge you X amount of dollars. And the copay is your portion that you have to pay, and then the rest of it is paid by the insurance company.
Okay, so we have our premium to pay.
Your premium to pay.
We have our copay to pay.
That's right.
Okay. And then what about a deductible? What is that, Ms. Africa? What is a deductible?
The deductible, there are usually limits set for on a yearly basis based on your family size, individual and a family group, and it's usually capped off at a certain amount and based on your visits to either your provider, your primary care provider, hospital, or different types of medical services will go towards that deductible, i.e. if it's $500, $1,000. But until you meet that deductible, a certain percentage of your health care, overall health care, will or won't be paid for.
Okay, so we have something that we have to pay beforehand, which is called the deductible, okay? We have our premium we have to pay first, but we have help with our premium if we're under ACA in one of the ACA plans. Now, what about with our employer-sponsored plans? We pay all of that expense ourselves when we have employer-sponsored plans for insurance?
Well, let me say this, okay? So I think that what happens is anybody who's looking at insurance needs to look at the plans that are available and look and see what their needs are. So if I was looking at insurance, I would first ask myself, what are my healthcare needs? Am I somebody who sees a doctor on a regular basis, or am I a relatively healthy person who has very little challenges? Healthcare challenges. Well, if I'm that healthy person, okay, I probably won't go to the doctor but once or twice. So
Right.
I probably want a lower premium each month. I mean, which means that I would probably pay a higher out-of-pocket cost. Now, if I was a very challenged healthcare person, I would look for a plan that has very low cost to me, so that because I would be accessing the healthcare more.
Exactly.
So I think that's what you have to do. And I think with employer-based insurance, I think that the objective is that the human resource department within that employer's company looks and sees what the overall health of the employees are and tries to pick a plan that has somewhere in the middle, has a medium type, out-of-pocket cost versus a premium cost.
Right. So when you say medium out of pocket, that's a lower cost.
Lower.
And a premium cost means that it's a lot
Right,
more.
that's right.
A lot more. And
It just depends on where you want to pay your money. You remember,
Right.
health insurance is you're taking a gamble. You're
Correct.
taking a gamble if something is going to happen to you or not. So if you're a relatively healthy person, I want to pay as little bit as possible into the system, but still have that safety net should something happen.
exactly.
If I'm challenged health-wise, then I want to get as much as I can out of the system.
Correct.
So
Okay,
you'll
okay.
pay more for that.
Okay.
And that was the premise of the Affordable Care Act, to balance the sick with the well, and both those individuals going into the marketplace to offset each other,
That's
to
right.
offset
That's
costs.
why they
Exactly.
wrote in, and that goes back to your question, Jermaine, about the individual mandate.
Correct.
That's why they mandated healthy people are in there to, like you said, offset that. But now, under the new tax law, we have the repeal of that mandate beginning in 2019.
Correct.
And I want to stress that begins in 2019. A lot of people think that began on Monday.
On
Correct.
Monday,
It
yes.
But
did
that
not.
it did not.
Okay.
No.
Okay. So will we still have a mandate under that
We
new
still
law?
so open enrollment for insurance for 2018, it was from November 1st to December 15th. And that law is still in place. You are mandated, the repeal of the mandate does not begin until January 1st, 2019. So if you do not have insurance this year in 2018, when you file
You
your
will be
2018 taxes, you will pay a penalty for not having
Yes.
insurance.
You will
Yes.
still pay
That
that
mandate
penalty,
still exists.
It still
Okay,
exists
okay.
until next year.
regardless of what the law is right now, the
That's right.
tax laws
Correct.
that are changing, it won't take effect
Well, and it's
until.
written into that it takes effect January 1st, 2019.
Correct.
Okay. All right, now Medicare, this is another kind of insurance that we have, right?
That's
What
right.
is Medicare?
Well, like Medicaid was meant for the poor. Medicare is meant for I don't want to say elderly, but it's for the older
65
folks,
and older.
okay? So 65 or older. So, this is insurance that most people pay into throughout their working life
Yes.
to be able to protect them once they no longer have access to employer-based insurance at 65 years old.
Right, okay. And Africa, can you tell me, what do you know about Medicare and how does it pay when you're a provider? Does it pay just like a regular insurance?
Again, it has its checks and balances. Like Brian mentioned, for individuals 65 and older, that was the initial concept in, I think, 1965. And then it was expanded in, I think, like 72 to include people with disabilities.
Disabilities,
Correct. And again, it has its premiums and things that there's different parts of it. Let's say that A, B, and C
Okay.
that exist. A usually pays for inpatient stays if you have to go to the hospital. B usually is outpatient, your normal PCP visits. And then C is buying into another part of health insurance. Correct.
Okay.
And there are pros and cons that comes with just about every insurance plan. And donut hole, I don't know, many people, they may be familiar with that terminology of where individuals get to this point with Medicare and they have to come out of pocket in order to pay for health care, prescription medications, because again, all these things are mandated by the governing bodies, Medicaid, Medicare, of what they will and won't pay for.
Okay. Now, what about this Part D? What is the Part D part of Medicare? I've heard people talk about that, but I'm not sure what that is. What is that? What is Part D?
The prescription.
Yes.
Okay. And that's important for your health care because
Yes.
if you're seeing a physician and you don't have the medicine to treat your condition, you need that Part D as part of your Medicare. So Medicare doesn't just blanket cover
No.
prescriptions.
Correct.
So we have to enroll in another part of insurance, and that's the Part D for drugs. That's what you're saying.
And they
That's what I
dictate on
understand.
which drugs will and won't be
Won't be
paid for.
paid.
And what pharmacies you can go to. I mean, it's, you know, what's sad, I will say this, that it's extremely difficult. It is very, very difficult to navigate the Medicare world.
Yes.
And, you know, I feel for folks that are turning 65 years old because there are so many things that you have to do and can't do and should do and can't do that I would encourage you to speak to someone,
Yes.
as you're getting into that, as you're beginning to turn 65 years
Right.
old, to help you navigate that process and understand what you need to do.
And that's so key, from a personal experience, having grandparents
Right.
that qualify, and he had no clue, my grandfather had no clue of where to go, how to do, and his actually payments went down after I got involved and called the appropriate people. And sometimes our older individuals have unique challenges with hearing and, things of that nature. And so he would venture not to call and talk to these individuals, and it just presents sometimes challenges for them to get the benefit of Medicare and the things that they have to offer.
I mean, we're experts in our fields
Correct.
of navigating these types of programs, and we still found it challenging. I can
Correct.
imagine what the common person on the street who's
Yes.
trying to navigate this whole process is going through. It's difficult. But there are programs specifically for seniors here
Correct.
in Acadiana that can help them do that, and most of them are free of charge. So I
Correct.
suggest you look them up and find them, and they will help you with that process.
Correct.
And that's why we hold shows like we are doing today, because we want to get that information out to people. We understand the challenges that people are having. After all, we're people,
That's
right?
right.
We're
Correct.
having the same challenges that everyone else is having. So what I've understood tonight is we still have ACA.
That's right.
We still have the plans under Affordable Care Act.
Correct.
And we can all get insurance.
Yes.
Exactly
Correct.
right. Okay. We have Medicaid, and we have that expanded also part of Medicaid. Is that part of ACA?
That's right. Medicaid is
correct.
part of the
That's
Affordable
part of
Health Care
ACA.
Act.
Yes.
We still have that mandate. We must have insurance,
Insurance, yes.
okay? So we want to make sure that we enroll in insurance, okay? Then we have Medicare, which is for the aged, which is 65 and over, or we have the extended plan for the people who are on disability.
Correct.
So you can have Medicare also, but you need to understand that there are certain parts of Medicare. There's an A, there's a B, there's a C, and there's a D part of Medicaid.
Correct.
D for drugs. A is for regular visits. It goes along with your Medicare.
Mm-hmm.
Is it free?
Medicare.
The A, Part A of Medicare.
There's deductibles.
There's
that-
deductibles and coinsurance like we
Correct.
talked about before.
Correct.
So when you have those deductibles, that is something that you have to pay
Pay.
for first out of
Correct.
pocket before your insurance will jump in and pay.
Correct.
We talked about deductibles before and coinsurance. You still have to pay something.
That's right.
Correct.
Even if you have a plan that's covered under all of these different kinds of insurances.
But you have choices, and so the most important thing
Correct.
to do is to understand what your needs are. And if you don't understand those, talk to someone who can help you, whether it be an agent or a broker or a financial planner, or someone who can help you identify what your healthcare needs are and help connect you to the kind of program that best works for you.
Meets your needs, correct.
So get some advice, get some support. Look for resources in your area.
And don't be afraid to ask questions.
That's right.
Never
That's
be
what we're here
afraid to
for.
ask questions. That's what we're here for. That's what we do these shows for. That's what we're out in the communities for, to support everybody. So our question is, where do we go from here? Thank you, Brian, and thank you,
Thank you.
Africa.
Thank you very much.